hypertension, decreased diastolic and systolic microcardial function, arrhythmia, irregular heartbeat, and decrease in venous return to the heart, which can cause what kind of clinical symptoms it might lead? Decrease in venous return to the heart. Think what kind of clinical symptoms might be shown that is triggered by this. Okay, how our blood reacts. Hematologic system. First, try to compensate. It's increase in the amount of RBC and hemoglobin, as I mentioned. More EPO produced and released by kidney. What's the function of EPO? Eosinopoietin. Okay, it's to produce more RBC. That's a hormone or substance produced by kidney and released to the blood flow and taken by the red bone marrow to produce more RBC. Improved RBC oxygen release abilities. It's a rightward shift of ODC, the oxygen hemoglobin dissociation curve. More 2,3-DPG produced from glycolysis process. Then let's have a look at the decompensatory effect. Because we have more RBCs in our flow, so the plasma viscosity will increase, more sticky, more easy to suffer from thrombosis, right? And blood flow resistance increased. Afterload of heart can increase. And when the pressure of oxygen is low markedly, 2,3-DPG will cause what it is? CaO2. It's a content of oxygen in artery to decrease. If you can't remember the abbreviations, please go back to review the parameters that describe the situation of hypoxia. And how our central nervous system respond. Let's divide the situation of hypoxia into two types, the acute and chronic ones. For chronic ones, patient will suffer all these symptoms like headache, agitation, poor faculty of memory, inability to make judgment, depressed, or loss of coordination. It's because the tolerance level of our brain cells are quite low compared with our muscles. And deficiency of oxygen for 15 seconds lead to coma. For 3 minutes lead to severe days of coma. For 8 to 10 minutes lead to irreversible brain injury. And that's theoretical time or duration. I think all of you should remember when we were learning the CPR procedures and practice on the dummies, and we were told the golden 4 minutes, right? The 4 minutes are very important, so we need to start CPR immediately once we made the judgment that the respiration and heartbeat of the patient both stopped. to save more time and to reduce the irreversible brain injury. And chronic hypoxia, it's impaired concentration, fatigue, drowsiness. These are the clinical symptoms that patients suffer from chronic hypoxia. Cerebral edema and neuron injury. Our neurons cannot be restored after once it's damaged. And the cerebral edema is more fatal than our lower limb edema because cerebrum are in a sealed space. When edema happens, there's no extra space for the cerebral tissue to expand to. So the pressure will cause further damage to our brain tissue. And tissue and cellular alteration. First, once they are facing hypoxia situation, compensation happens. Enhanced cell ability for use of oxygen, like number and the membrane surface of mitochondria, increase activity of succinic dehydrogenase and CYP oxidase, all increased to increase the cell ability to use oxygen. And once they're facing hypoxia, tissues needs to adjust to make good use of the oxygen they can get, even though it is less. But if you make good use of it, the tissue can still can manage. The other aspect, enhanced anaerobic glucolysis. If there is no enough oxygen to use, we can rely on anaerobic glucolysis. And enhanced myoglobin. Myoglobin can get involved to store more oxygen inside our body, which normally they do not use this function. And low metabolic state, energy consumption drops to save more energy. Like if you have shortage of food storage, you will reduce the amount of food that you consume every day until you're sure you can get enough food supply. Then you go back to normal food consumption, the same to our cells and tissues. After trying all these means, decompensatory state comes. Cell membrane injury will happen. The sodium influx will cause cell swelling. The potassium influx will cause lymphatic disorder, and the calcium influx will cause these two enzymes, phospholipase and calcium ion dependent protein kinase to increase. And the mitochondrial injury will cause the increased oxygen-free radical to cause more damage to the cell. Lysosome injury will happen too in the decompensatory effect. Please have a look. When hypoxia happens, what kind of clinical symptoms? We might have after what happened in the cellular level that's shown on the screen. Okay, let's continue. Which is the end, finally, of this